Hi, I'm Robert Cohen.
Hi, and I'm Ayako Mansell with Cohen Medical Centers.
We're here to tell you about one of your newest products. They're the Cohen Medical Centers CBD capsules. They come in two different sizes, 15 milligram and 40 milligram. Full spectrum medicine, which means there is a little bit of THC in there, but not enough for them to be really intoxicating to any clients.
Right, and so when we're talking about the different doses, about the 15 milligrams and 40 milligrams, it will just kind of depend on the person that you're talking to, whether or not maybe they're a new user or somebody who is on a lot of medication versus somebody who's maybe a more experienced user with cannabis or not taking any medications at all and just looking for a lot more relief.
I think at this point you probably already know who the CBD clients are. Well, easier yet, who they're not. If you can identify who the CBD clients are and actually have a meaningful 5 to 10 minute conversation with them about CBD, they'll be a monthly visitor, and it's something that they're going to use over and over because it works. And the whole key for us and the success of our product is getting people to relief. We can get you cannabinoid numbers, we can get you terpene numbers, all that. Everything's full spectrum, it's all there. But if a client doesn't get, or a patient doesn't get to relief, then the product is worthless because they never buy it again and they think that it doesn't work. So the way we normally do that with someone that's not used to using cannabinoid product or the CBD product is we sell them some of the 15 milligram capsules. We tell them to take a capsule and see how they feel. If they don't feel anything within an hour, 2 hours, usually 2 hours, they take another one until they get to relief. They really need to know what relief feels like. That achieves a lot of different things for us and for your patients. It tells them what their dose is. They also know how long that it lasts for, so that we know that we can repeat it.
Right. And so you starting off with the 15 milligrams, you can easily suggest and move them into taking this as a daily kind of dose or repeatable during the day as much as they need it. And so you really want what we suggest, the steady state medicine. So treating on the outside using things like topicals can help you in emergency relief or when you're feeling the pain immediately and you want some kind of help.
Or even a tincture for that matter. A tincture works the same way, much the same way. It works fast, but it doesn't last as long.
Right, because it gets into your bloodstream a lot faster. But when you're working with a capsule, when you're dealing with it breaking down, you're actually having a little bit longer release, as that we've noticed, and so you're actually able to dose yourself more repeatably.
And predictably.
Yeah.
So the key, what we're finding is people coming back month over month. It's not a glamorous product. It's not the highest THC. It's not what somebody wants on a Saturday night, but it's what people want every day to be able to function and be able to get through their day. We've done almost everything we can do to be compliant here in Nevada. Our product comes from a FDA certified facility. It's finished here in Nevada. We've been selling effectively here in Nevada for about 2 years, have a pretty good client base, but it takes a little bit of time at the beginning. You have to take the time and be patient in the beginning with these people, and you'll have them forever. And it's an easy throw on. I mean, if people aren't getting predictable results from concentrates or smoke or however they're using cannabis, the CBD capsule can balance out how they use cannabis. And really what everybody wants out of cannabis products is balance. And the high onset of a smoke and then the quick offset is not what a pain patient needs. What a pain patient needs is the same amount of medicine all day, every day. Then when you get the breakthrough, then you use the topical, you use the tincture, or you use the smoke. You use whatever you need at that point.
And so if you're also dealing with patients who may be on a number of other medications, the caveats that we're figuring out and we're learning as we go through this are that That same 2-hour window to determine on whether or not you need another dose of the CBD is also a good recommended window for what you would see in terms of other medications. So taking pharmaceutical medications and then giving a good 2-hour window is really a little bit more, you're letting each one run its course individually.
We're also, kind of to dovetail on the pharmaceuticals, we're seeing a lot of the pharmaceuticals that these people are on work a lot better when their body is receptive and on the CBD oil. So just a side note, if people have peculiar symptoms and they call, a lot of times it's not the CBD, it's everything else that they're working with. So again, a dosable, repeatable product, easily sellable, easy price point. This is for everyday use. It's a multivitamin. It's how I take it. I take it every day if I need it or not. If I need more, I take more. But I always take the same amount. It's served me really well.
And taking it, and depending on obviously your body chemistry and how it works with you, different people report different reactions and maybe kind of side effects from it. There is caryophyllene in this, so that's a lot of inflammation relief and can be very calming as well. And so it can be a bit of a sedative. And so sometimes if you see too much of a sedative effects, you would obviously just instruct them to maybe use that more towards bed, and or split the doses between morning and, one in the morning and one in the afternoon, or one in the morning and one in the evening. Dosing at bed to help people sleep can also be shown to be very useful. A lot of the conversations that we have with some of the pain patients are that, especially if they're smoking before bed, it will help them relax and actually get to sleep, but it doesn't help them stay asleep. So something like a capsule that may release a little bit longer and give you a longer dosable effect, they may get more rest with that as well. So if rest is something that they're looking for along with the pain, that's kind of what drives when you would instruct them on how to take it as well. If they have problems waking up in the morning and they're more stiff in the morning, then you can help instruct them to push it in the morning. This is something that you can easily take on an empty stomach. If you take it in the morning before your other medications as well, that can help people determine whether or not they actually want to either continue to dose themselves with the medications that they're currently on, or if they need that same amount of dose. There's a number of patients we see dosing down, taking half doses every other dosing, and then eventually completely moving off of other medications with CBD.
But individual results vary. So.
Absolutely.
I mean, each person's different, each case is different, but you're going to find out that the CBD, the hemp medicine that we're selling, that you're selling, is really going to, help the people's general health. So good luck out there.
Yeah. And the 15 and the 40 milligrams they are numbers and they can be useful starting points, but you don't have to limit yourself to that. You can break them open, you can use them as needed, you can use them topically and many other ways than just internally. Make sure that they know that they have the freedom to use this medicine as much and as openly as they need to. Thank you so much for choosing Cohen
Sure.
Medical Centers.
Questions, you know where we are.
Yeah.